Hi everyone, and thank you for attending today's webinar. My name is Tiara Brooks from School-Based Health Alliance, and we would like to thank everyone for attending today's webinar titled Confidentiality in School-Based Healthcare, EOBs, Billing, and Health Insurance Claims. Confidentiality protections are an important element in the effective delivery of school-based healthcare. This webinar will identify the major ways confidentiality can be breached in the billing and insurance claims process, identify policies that a few states have adopted to limit confidentiality breaches, and understanding how federal and state laws affect confidentiality in the context of billing. We have a few housekeeping reminders before we get started today. If you are viewing as a group, please go to the chat window in the question box and type in the name of the person registered and the total number of additional people in the room. For example, Tammy Jones +3. This will help us with our final attendance account. All attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the question box located in your GoToWebinar control window. We will address questions following the presentation. Please keep in mind we would like to address all questions, but some questions may depend on the law in a specific state. If we can refer you to a relevant resource, we will be happy to do so. So please enter your question in the question box. Also, attendees will be asked to complete evaluation poll questions at the end of this webinar. Please let us know how we are doing. Your feedback is vital in helping us craft presentations that will meet your needs. Also, this webinar is being recorded and will be archived and on our website in 3 to 5 business days. Also, please visit School-Based Health Alliance website for additional archived webinars. I would like to introduce our presenter today, Ms. Abigail English. Abigail English is a lawyer, researcher, and advocate for the rights of vulnerable young people. Since 1999, she has directed the Center for Adolescent Health and the Law. From 1976 to 1998, she was an attorney at the National Center for Youth Law in San Francisco, California. Her research and advocacy have focused on health insurance and public financing of care for adolescents and young adults, consent and confidentiality protections, and sexual and productive health care. Her work focuses on sexual exploitation and sex trafficking of adolescents and young adults. I would now like to introduce our presenter, Ms. Abigail English.
Thank you very much, Tiara, and thanks to everybody who has joined the webinar this afternoon. I'm really pleased to be with you on, again, I say again because some of you may have participated in 2 previous webinars on confidentiality issues in school-based health care that were part of a kind of series that we're doing. One was last December 2014, and the other was in April of this year. Today, we're going to be looking at an issue that is on the minds of a lot of people, and that is how can we continue to protect confidentiality for school-based health centers and other healthcare providers who take care of adolescents and young adults while still securing coverage and benefits that people have under their health insurance policies. So I'm really pleased. This is an issue on a lot of people's minds, and I'm very, very happy to be able to talk with you about it this afternoon. I have to say in advance that there are lots of unanswered questions in this area, and it's very much a work in progress. So hopefully some of you will have comments or contributions to make at the end of the webinar to share any experience you have or solutions that you may have come up with in your state or in your particular setting. So to dive right in, I would like to thank some colleagues of mine with whom I have worked on these confidentiality and insurance issues, Rachel Gold and Elizabeth Nash at the Guttmacher Institute, and more recently Robin Summers, Julie Lewis, and Claire Coleman at the National Family Planning and Reproductive Health Association. All of them have really been wonderful colleagues and helped me understand these challenging issues that we're going to be talking about today. And at the end of the presentation, I'll list a couple of publications that we worked on together so that you can access those publications online. So just to give you a sense of what we're going to be talking about this afternoon, first of all, I'll give just a little bit of an overview of how confidentiality breaches occur, primarily in the health insurance claims process. If we're truth in advertising, I've included the word billing, but it's really billing to health insurers that we'll be talking about this afternoon, and not so much other general billing issues. And then we'll review the federal and state laws that protect confidentiality that have some relevance in the context of health insurance claims, and some of the federal and state laws that require disclosures in that process. And then finally, to end on an up note on some of the evolving protections that are occurring in states around the country to try to address this tension between the disclosures that occur in the health insurance claims process and the need to protect confidentiality. So we're going to start you right off with a poll question. Do laws protecting confidentiality take precedence over laws requiring disclosure of health information? And the answers you have the option of giving are always, sometimes, never, and not sure.
Okay, we'll give everyone a few seconds to answer the question. All right, 2 more seconds. Okay, we have 44% that said sometimes.
Well, that's very interesting, and I think this is a tough question to answer, and I need to get back to my slideshow, which seems to have, okay, there we go. This is a difficult question to answer, but I think that those of you who said sometimes are probably closest to the mark. And hopefully, as I go through some of the material we're going to cover today, you'll have a better sense of why that is and what that means. So the reason that confidentiality is so prone to being breached in the insurance claims process is that there are a wide variety of communications that insurers enter into with their policyholders and sometimes with the beneficiaries and enrollees in their health insurance policies and plans, as well as with providers. And those communications have the significant potential to breach confidentiality and compromise patient privacy, particularly when someone is covered under a policy of another family member. And of course, those of you who are working in the school-based healthcare setting are generally dealing with young people who are covered under somebody else's policy. And usually that's the policy of a parent. And so the kinds of consumer communications that insurers use generally go to the parent, and if they involve services that were provided on a confidential basis, they have the risk of breaching that confidentiality. And we'll explore this more as we go along. These breaches involve, as is often the case in health laws that affect adolescents, an intersection of both federal laws and state laws, and an intersection between confidentiality protections and disclosure requirements. On top of that, there are significant differences between the way these consumer communications are handled in Medicaid and in commercial or private health insurance plans. And we'll try to clarify that this afternoon as well. So obviously in 1 hour this afternoon we can't delve deeply into all of the relevant federal and state laws, but there are some highlights that I think we need to focus on. And in terms of federal law, those include the HIPAA privacy rule, the Title X family planning regulations, the Medicaid laws, and a few other federal protections that have some relevance in this area. And then in terms of state laws, we need to think about the ways in which states have implemented HIPAA in their own state statutes and regulations, as well as the general medical privacy and confidentiality protections, particularly the confidentiality protections for minors. Now, in terms of the latter two of those, the general medical privacy and confidentiality protections and confidentiality protections for minors, those were really the subject of the first two webinars, and I don't plan to go into them in any detail this afternoon, but those webinars are archived on the Alliance website, and you can go back and review those or watch them, look at them if you did not have a chance to participate the first time. So in terms of the HIPAA privacy rule, just to review very quickly, it protects the rights of individuals regarding what is a term of art, protected health information, or PHI, by giving them access to their own information, some control, not complete control, but some control over the disclosure of their protected health information, and the right to request particular privacy protections. And that last bullet is one that we're going to delve into in quite a bit of detail this afternoon as we move along. Under the HIPAA privacy rule, minors are considered, and I could put this word in quote, individuals, that's the legal term in the rule, if they are authorized to consent for their health care and do consent, or if their parents have acceded to a confidentiality agreement between the minor and the healthcare provider. So in those two circumstances, minors are considered individuals, and they have some of those rights to access information, control, disclosure, and request privacy protections. There's a whole set of kind of other requirements related to when parents have access to minors' PHI under the HIPAA privacy rule that we're not really going to delve into this afternoon because that was discussed in detail in the previous webinars, but I'm happy to answer questions about that. But just it's important to know that minors do have the right to request privacy protections under the HIPAA privacy rule, because we will be coming back to that this afternoon. So these special protections that individuals have a right to request under the privacy rule are restrictions on disclosure of protected health information, or they can request that communication take place by alternate means or at alternate locations. And that's something that has laid the foundation for some of the laws that are evolving in various states around the country. And so when we get to that part of the discussion this afternoon, we'll come back to these particular protections under the HIPAA privacy rule. I'm sure that most of you are familiar with the Title X confidentiality protections. I know that some school-based health centers are Title X funded sites and provide Title X services, and those are, of course, among the strongest confidentiality protections that exist in the healthcare realm under either federal or state law, and they do protect individuals of all ages who are receiving services at Title X funded sites. So I won't read the entire regulation, but it is a very comprehensive and important one, and has guided the delivery of federally funded family planning services for more than 40 years now. And it has, as many of you know, been challenged and been threatened on a number of occasions, but continues to be the sort of flagship of the Title X system. So other important federal confidentiality protections include the Medicaid rules, and those include general safeguards against the disclosure of confidential information that are pertain to Medicaid beneficiaries, but then also a requirement that family planning services for beneficiaries include minors who can be considered to be sexually active. And so that is an important protection that exists at the federal level. The next issue that's important to understand from the perspective of this question of confidentiality and insurance in terms of Medicaid is that Medicaid is considered a payer of last resort. So if someone has other insurance, particularly other commercial insurance, that insurance is supposed to be billed before Medicaid is billed, or sometimes Medicaid is billed and then Medicaid goes after that other coverage, and that's referred to as the third-party liability requirements in Medicaid. There is a good cause exception to that, and so some states have developed good, clear guidelines and policies around this good cause exception, and we'll talk about that a little bit as we move along. So just to review other federal confidentiality protections that are relevant pertain to the federally qualified health centers and community health centers, which have a requirement that's similar to Title X. Ryan White Care Act has strong confidentiality protections, and the federal drug and alcohol treatment programs are subject to very strong confidentiality protections, which include minors who are able to consent for drug and alcohol related treatment under their state's laws. So moving from the confidentiality protections to the disclosure requirements, again, there are issues in both federal and state law, and there are issues in federal law under the HIPAA privacy rule, which we did just look at some of the confidentiality aspects, as well as under ERISA and the Affordable Care Act. particularly with respect to notices, requirements for notices of denials of claims that have to be sent out. And we'll look into that in quite a bit of detail in just a moment. And then under state law in almost every state does delineate a wide array of requirements with respect to health insurance. And those requirements often set out certain types of communications that occur between insurers and other parties, including explanations of benefits, notices of denial, acknowledgments of claims, requests for additional information, and a whole series of other kinds of communications. But the two leading ones that we encounter most frequently are EOBs, or explanations of benefits, and denials of claims, or notices of denials of claims. And the recipients of those communications are often specified in state laws, and they vary quite a bit from state to state. Most frequently, the policyholder is specified, sometimes the beneficiary, the enrollee, the claimant, or some other individual. But the policyholder is commonly the target of, or the recipient of, these communications. And then some states also go further and specify the content of the communications, particularly with respect to EOBs and denials of claims, and the kinds of information that are required to be, or specified to be, included on these communications have largely to do with the provider, the type of service, the charge, etc. In addition to federal and state law, many disclosure practices or policies are set out in the policies and practices of the insurers themselves, in their contracts with the purchasers that are sometimes the employers, sometimes the individual policyholder, and a whole host of other policies regarding their privacy notices and other types of policies that may be either in the contracts or posted on their website or sent in beneficiary booklets or policyholder booklets. So let's take another poll question. Federal law requires requires the sending of an explanation of benefits for all health insurance claims.
Okay, and we give everyone about 15 seconds. Okay, 3 more seconds. Okay, 43% said yes, 44% said no, and 13% is not sure.
Well, that's very, very interesting, and I'm not surprised because I have had insurers tell me, we have to send explanations of benefits. It's required by federal law. And I've had other people tell me, no, federal law does not always require the sending of an explanation of benefits. So the fact that you all were pretty evenly split on that is not at all surprising. In fact, federal law does not require sending an explanation of benefits for all health insurance claims. However, I will explain to you why people often say that it does, because that's been a critical kind of stumbling block in the effort to make sure that confidentiality is protected even when people are trying to use their health insurance coverage. So we'll talk now a little bit about the specifics of the federal laws related to disclosures. The HIPAA privacy rule allows disclosures to anyone with the authorization of the individual or the personal representative of the individual with respect to their protected health information. But the HIPAA privacy rule also allows for certain disclosures without authorization. And those circumstances are that disclosures of PHI is permitted for treatment, payment, or healthcare operations. And that second word, payment, is the critical one here because that's one of the ways that some of this information ends up being able to be disclosed, even when there are other confidentiality requirements that would otherwise apply. Nevertheless, authorization is routinely obtained, as many of you, probably all of you, know from going to the doctor's office and signing a form that says, yes, you can disclose my information to the insurance company in order to submit a claim on my behalf. So the obtaining of authorization is quite routine. This slide is probably in some ways the most important of the disclosure slides, and that is that federal law in a set of regulations that are consolidated regulations from the Department of Labor, which is the agency that oversees ERISA, the Department of Health and Human Services, which is the agency that oversees certain aspects of the Affordable Care Act and Medicaid, and the Department of the Treasury, which oversees certain aspects of the Affordable Care Act. The consolidated regulations require that there be notices sent whenever there is what is referred to as an adverse benefit determination. And an adverse benefit determination involves any situation in which there is a failure to make a payment in whole or in part. And that includes any situation where a plan pays less than the total amount of expenses with regard to a claim, including denial of part of the claim due to the terms of a plan or health insurance coverage regarding co-payments, deductibles, or other cost-sharing requirements. And what that means is healthcare provider A submits a claim for a service for $150, and the health insurer pays $75 because that's the negotiated amount. That's a denial in part, failure to make a payment in part. Healthcare provider B submits a claim for $150, and the health insurer says, well, $50 of that goes to fill out the deductible, and then after that there's $100 that's approved, but we only, under our negotiated contract, pay $50 of that. Again, that is a notice of adverse benefit determination and has to be sent. And generally, those are sent to the policyholder. And generally, they have to contain the date of service, the provider, the diagnosis code, and so forth. And so that's a significant way in which confidentiality can be breached. Other federal laws that are relevant with respect to disclosures in both Medicaid and commercial insurance are the following. Medicaid does not require that EOBs be sent to the beneficiaries or to the enrollee. However, it does require that something be done to verify that services billed were provided. And some state Medicaid agencies use a kind of EOB to fulfill that requirement of verification. But some state agencies suppress those when the services are considered sensitive services. Medicaid managed care organizations, which represent an increasing proportion of the Medicaid covered population, are required to issue notices of denial, the adverse benefit determination that I talked about on the previous slide. And then commercial insurance carriers are definitely required to issue notices of denial, these adverse benefit determinations, and those notices often take the same form as any other explanation of benefits. And I think it's for this reason that the insurers sometimes say, well, we have to send EOBs because that's the mechanism they use to communicate these adverse benefit determinations. So the good news is that states are really beginning to wrestle with these issues. And part of the reason for that is that there is an increasing number of young adults who have been allowed to remain on their parents' health insurance up to the age of 26. And so that is kind of raising the visibility of the issue. And in addition, there's been some increase in the number of adolescents who are covered as well. So there's significant variation among the approaches that are being taken by different states. And many of those approaches are grounded either entirely or partly on some of the protections in the HIPAA privacy rule, but then go beyond the specifics of the HIPAA privacy rule in delineating what's required of health insurance carriers. So the states that currently have incorporated specific new protections into their state laws include California, Colorado, Illinois, Maryland, New York, Oregon, and Washington. Washington's protection actually has been on the books for almost 15 years. New York's has been on the books for a while as well. Illinois is brand new and deals with Medicaid. And then California, Colorado, Maryland, and Oregon deal primarily with commercial insurance. There's a pending bill in Massachusetts that is quite comprehensive but has not yet been enacted. And these state laws, some of the sort of categories of approaches that they've adopted include provisions related to requests for confidential communications, the management of explanation of benefits, restrictions on disclosures, and specific protections for adult or minor dependents. And I'll give some examples of those as we go forward here. But before I do that, I'd like to just highlight something that I'm not going to discuss in detail, but we can come back to in the question and answer portion if you like. And that is that one of the major challenges that people are confronting in states that are trying to find ways to protect confidentiality while still allowing people to use their insurance is the need to account for deductibles, cost sharing, co-payments, and co-insurance. And as more and more plans are higher deductible plans and more plans involve significant cost sharing and co-insurance, this is an issue of increasing interest and concern. And so some insurance carriers are saying, well, we can't provide these confidentiality protections because we have to notify the policyholder about the deductibles and cost sharing and so on. And so that remains a challenge that has not yet been resolved, but needs to be addressed in any effort in any state, either to adopt a new law, a new regulation, or enact a new statute, or implement one that's already on the books. So California in 2013 enacted a bill that was referred to for a long time as SB 138 and is now being referred to as CHIA, or the Confidential Health Information Act, and it became effective in 2015. It's a very detailed statute that allows individuals to make requests of their health insurers that communications take place in a confidential manner. And remember, the HIPAA privacy rule allows this to occur, health insurers must allow individuals to request confidential communications. But the California bill goes further than HIPAA by saying that these requests have to be granted by the health insurers, and that the health insurers cannot require people to say why they would be endangered if the information was disclosed. The bill makes clear that both minors and adults are protected, and that these confidential communications requests can be made in any situation, either where the person feels they would be endangered, or even if they don't feel they would be endangered, if they're receiving one of a number of enumerated sensitive services. And that's a fairly long and predictable list of sexual and reproductive health services, STD, mental health, substance abuse, and so on. Colorado took a regulatory approach and adopted a regulation in 2013, which became effective almost immediately in 2014, and it requires insurers to communicate in a confidential manner to conduct its communications in a confidential manner, and it applies only to adults who are covered as dependents and not to minors. And advocates in Colorado and the Department of Insurance and other stakeholders in that state are working on trying to figure out if there's a way to expand the regulation to apply to minors as well as adults who are covered as dependents on a family member's health insurance plan. Washington actually has had a regulation on the books that was adopted in 2001, and that contains rather detailed requirements for the way in which health insurers may or may not communicate with or communicate confidential information, and it applies both to minors and to adult victims of domestic violence. And that regulation has been on the books for some time, but has not been extensively implemented, and there's a coalition of stakeholders in Washington state who are now working to try to get some consistent implementation of that regulation and some action by the carriers to adopt some consistent methodologies, and for the insurance department to have some accountability for the implementation of this regulation. So last poll question: in every state, patients I'm sorry, there's a typo in this poll question. In every state, health insurers must allow patients to request that their EOBs be sent to a different address. Yes, no, or not sure?
And we'll get everyone in about 15 seconds to answer. Okay, 3 more seconds. Thank you, everyone. We have 52% that said yes, 29% that said no, and 19% is unsure.
Okay, well, the majority wins on this one. It is true that in every state, health insurers must allow patients to request their EOBs be sent to a different address because that is a requirement in the HIPAA privacy rule. But it's not surprising that not everybody said yes on this one because this has not been widely implemented, or at least not widely implemented in a way that patients and beneficiaries are aware of. And although health insurers must allow the patients to request it, they are not necessarily required to grant the request. And so that's what we're going to look at now. As I mentioned earlier, there are 2 different protections under the HIPAA privacy rule that patients, individuals must be allowed to request. And one of them is restrictions on disclosure of their protected health information. And providers and insurers must allow this kind of a request to be made, but they're not required to comply unless they agree to comply. They must comply, however, if payment has been made in full by the patient or somebody else. So if somebody comes in and self-pays, or if there's no charge for the information, for the service, then a patient could request restrictions on disclosure, and both providers and insurers would be required to comply. The second protection is a request for communication by alternate means or at alternate locations, and providers must accommodate reasonable requests of that nature and may not require that that providers may not require that the patients state that they would be endangered. Health plans must also accommodate reasonable requests, but they may require individuals to say that they would be endangered if the information were disclosed. So these rules are a little bit confusing, and it's not surprising that they have not been widely implemented because they do put the onus on the patient to come forward and request the protection, and most patients have no idea that they have this right. So just to go through those few categories of protections that are showing up in the new state laws, management of EOBs is one category, and that includes these requests for confidential communications. And some states are not only incorporating the HIPAA standards but going beyond them and including broad definitions of what endangerment would mean, all the way, not to go beyond anything like physical violence, but to include harassment or even limitations on access to health care. Redirection of explanations of benefits to the patient. Some of the laws are requiring the patient to request it, but I think maybe it's the Massachusetts law that's pending that would require it even without a request from the patient. exclusion of information about sensitive services, omission of EOBs when no balance is due, or outright suppression of EOBs. This is extremely rare. Restrictions on disclosure are generally based on endangerment and a statement that disclosure could jeopardize the safety of the individual. But, for example, in California, the law specifies that individuals cannot be required to say why they would be endangered. All they have to do is say they would be endangered. And then restriction on disclosures of sensitive services generally relate to reproductive health, STDs, chemical dependency, and mental health, may involve a statement of from whom information should be withheld, that's in the Washington law, or how payment will be made for any cost sharing, that's also in the Washington law. And then protections for adult children or adult dependents who are covered on a family member's policy. This is the Colorado regulation, which requires that communications between the carrier and an adult child must remain confidential and private, and the communication cannot go to the policyholder without the permission of the adult dependent. This would be less relevant, I'm presuming, in most school-based health center settings, except as to 18-year-olds or 19-year-olds who may still be in high school. And then Washington, for example, allows for restrictions on disclosure of sensitive information about services for which minors are allowed to give their own consent. We're not going to talk about EHRs and web portals today, but I wanted to include this slide because ultimately there is an interaction or intersection between how health information is handled by providers, by health insurers, not only in other aspects of the billing and health insurance claims process, but also in terms of the electronic health records and web portals. And the critical questions have to do with who has access and at what ages: the adolescent minor patient, the young adult patient, the parent, and what the effect of these various laws that we've been talking about this afternoon have, what the effects are in the context of EHRs and web portals, the HIPAA laws, the minor consent laws, and the insurance laws. So perhaps we'll have another webinar someday to talk about those issues, but I do think it's important because they are, in a sense, the next frontier. So I'll just close my presentation by saying that because of the increased number of individuals with Medicaid and commercial insurance since the advent of the Affordable Care Act, and because of the increased number of young adults who are staying on their parents' health insurance plans, the question of the significant potential for confidentiality breaches in the billing and health insurance claims process is gaining increasing visibility and is generating significant efforts and advocacy to bring about protections at the state level that build on the HIPAA privacy rule and the other confidentiality rules that exist, but that these efforts face considerable challenges, particularly related to dealing with the issues of deductibles and cost sharing and communication and transparency regarding those issues for the policyholder. So I'll close my presentation and we can open this up for questions. I've cited two reports. One was from 2012 and one was from this year that go into considerable detail about the laws in this area. So thank you.
Thank you so much, Abigail, for this wonderful presentation. Like Abigail said, once again, we'd like to give everyone this opportunity to please answer your questions, and we'll try to give you the best answer as possible. For those that may be more state-specific, we would definitely try to follow up with resources and questions that we're not able to get to before the end of the webinar. We'll be sure to contact you afterwards, so please make sure that you enter your questions that you have. We would like to next definitely encourage everyone, become a member at School-Based Health Alliance. We have great opportunities for you. Once you become a member, you get first-hand information to also things like blueprint access and how to start up a school-based health center, so other helpful tips if you already have a school-based health center. It is $100 for individual and $500 for organizations. So please, please, we encourage everyone to please become a member. Right now, we'll give everyone a few seconds to enter your questions that you may have for Abigail. Okay, Abigail, we have our first question. Our question is, how can a minor request EOB from Medicaid be sent somewhere else?
Okay, so the question is, how can a minor request that an EOB for Medicaid be sent somewhere else? And the answer to that starts with knowing what your state Medicaid agency's policy is around sending of EOBs in the Medicaid system. Because some states do not send EOBs in Medicaid, and some states send them sometimes but suppress them for sensitive services like sexual and reproductive health services, STI services, etc. So the first step would be to find out what your state's Medicaid agency's policy is around it. And the next step would be to see whether on the Medicaid agency's website there is a form for requesting confidential communications and redirection of an EOB. If there is not, then it may require some advocacy with the state Medicaid agency to generate some kind of a mechanism or procedure for people, patients, to enrollees and beneficiaries to ask that that any communications be redirected.
Thank you so much, Abigail. We have another question. What is your position on ghost files for students in school-based health centers who are receiving confidential services?
I'm sorry, I didn't understand one of the words early in that question. Could you just restate it?
Yes, definitely. What is your position on ghost files for students in school-based health centers who are receiving confidential services?
I understand the question to be, what is my position on ghost files for students who are receiving confidential services in school-based health centers? And I do not have a position on ghost files. And I'm presuming here that ghost files mean sort of a separate file that's kept with regard to confidential services. And I think this is one of those questions where an analysis would need to be done about what kind of documentation requirements exist for healthcare professionals, nurses, doctors, etc., under state law. Because if there are specific documentation requirements either in state statutes, state regulations, or the professional licensing boards in the state, then those would have to be taken into consideration in deciding whether or not it was permissible to have what are being referred to here as ghost files. So I don't have a general position on it. I understand the motivation to maintain separate files, but there are strong reasons for making sure that certain kinds of information is documented in a way that other care providers may be able to know about. And so it's a difficult question, and legally it would depend on an analysis of specific state requirements.
Okay, thank you so much. It looks like that is our last question for right now. We do want to let everyone know that this is being recorded, so any of the questions that have been asked, and Abigail gave a response, that it will be with the recording and uploaded to our website on our archived webinars in 3 to 5 business days, including the slide deck presentation also. We'd like to thank you again, Abigail, and we do have a few questions for our attendees. We just want to make sure that we continue to provide better services and webinars for you in our future. So our first question is, so did this presentation meet your needs? And we'll give everyone a few more seconds. Thank you, everyone. And our next question is, how well did this presentation meet the stated objectives? And we'll give you about 15 seconds. Okay, a few more seconds. Okay, and our next question is, how likely are you to apply information from this presentation in your organization? And we'll give everyone 15 seconds. A few more seconds. And our final question, would you recommend this webinar to others? 15 seconds. Okay, a few more seconds. Okay, once again, we would like to thank Abigail English for this amazing webinar and great information. And to all of you, our attendees, we appreciate you for attending today's webinar. Once again, this webinar is being recorded and will be archived on our website. Any questions that you may have, we will follow up with Ms. Abigail, and we'll try to give you the best resources that we can to provide you for your specific state questions. Again, thank you everyone for attending today's webinar, and have a wonderful